another important exam topic and also a spotter which the resident might get in the exam. The topic of discussion for today is Perma catheter. Perma CATH. It's a Perma CATH is the trade name. If I have to tell technical term, that is tunneled subcutaneous cuff catheter. I hope medicine didn't get this technical terminology. Let me put it in simple terms. Subsequently, we'll see the X-ray. So if we take a hemodialysis vascular access, if lifeline fistula is there, well and good. If fistula is not there, temporary catheters are placed. If we take a simple temporary line, let us discuss only the internal jugular vein catheter. Similar to a central line, skin, subcutaneous tissue and enters the vessel. That is called simple central line. If we put a hemodialysis catheter, which is just going from skin, subcutaneous and blood vessel, so there is nothing is there, directly it is entering the vein, internal jugular vein. That is hemodialysis catheter. We are using it for the dialysis. Venous blood is taken to the hemodialysis machine and returned back to the patient through the same line. Only thing is the difference in the blood where it is released, tip and the side. This is the usual simple hemodialysis catheter where the line goes directly. But there is a disadvantage. What is that? The time limit. That catheter, unlikely we can keep it for more than 6 weeks. In some patient 4 weeks. Why? Skin, subcutaneous tissue, blood vessel, there is a risk the infection can spread from the skin into the blood vessel. That is sepsis. There is a chance patient will develop the sepsis. So that is why there is a time limit. The catheter can't be kept for a longer period of time. We have to remove it. Suppose if patient is requiring dialysis for a longer period, what to do? There comes this tunneled catheter. Tunnel. What is tunnel? Tunnel is nothing but which is going inside something. Tunnel. A common word. Okay. What is this Perma CATH do? Skin subcutaneously travel for some centimeter, 5 centimeter, 6 centimeter. It won't get exposed to the environment. Underneath the skin only it enters the vessel. That is why it is called as tunneled subcutaneous cuff will be there. Cuff is nothing but, let us take this as a catheter. There will be some thickened structure like fibrotic structure which is there in the pathway in the subcutaneous plane, so that the infection migration is very less. So the chances of infection is less and the catheter can stay for a longer period of time. How long it can stay? Till the time it is getting infected. I have seen patient where this catheter worked for more than 5 years, 6 years, 7 years. The time limit is more. So there is advantage. Not only for years, it can be kept for weeks also with less chances of infection. Okay. Since it is kept for a longer period, that is why the name Perma CATH. But that is a trade name like aspirin, ecosprin. Ecosprin is trade name. Aspirin is the drug name. Like that, tunneled subcutaneous catheter is the actual name. Perma CATH. Perma, what they thought permanent catheter. So Perma CATH. But it is not permanent unless it is infected. It can be kept for a longer period of time. So how long it can be kept? As I told, till the time it is getting infected, and on average years it can stay. One more question student asks, sir, is it only for CKD? As per the guideline, whenever a patient requires dialysis for more than a week, preferably they say to put this Perma CATH. What is the disadvantage? Cost. It is a bit costly compared to the simple catheters. It takes some more technical time and expertise is required to insert it, to make the tunnel, probably a angiography room or the cath lab or a place where CM machine is there, that might be required. Without that also can be inserted, but there is a risk. The size is big, the length is bigger. This is the brief intro for the permacath. Where are all the permacath can be placed? Internal jugular vein, right side and left side, femoral, in the inferior vena cava, very rarely subclavian vein. These are the places permacath can be placed. Most commonly, this permacath or tunneled subcutaneous cuffed catheter. The cuff is nothing but small bulge-like structure which forms the adherence with the skin subcutaneous plane. Skin underway subcutaneous plane, then it prevent the infection was going through. That's all. And this is the info which is required for permacath. So X-ray we will discuss. First we will see a X-ray which is showing the permacath on the right side. Either it will be in the background or it will be in the screen. Now you can see the permacath is on the right side. It is like a U-shaped structure. That is why a medicine resident might get confused. What is this much big? These permacath are lengthier, 19 centimeter from the cuff to the tip. Approximately you can remember it is lengthier than the simple catheter. Where it is entering the skin, it is entering near the nipple area or 4 to 5 centimeter below the clavicle. That is why in the X-ray you are finding a U-shaped curve. It is entering the skin, it is not entering the vessel. It is subcutaneous plane where it is going. It is taking a U-turn above the clavicle and entering the IJV, internal jugular vein. So this is the X-ray finding. So where is the tip? As you see in the X-ray, the tip is in the right side of the heart. The ideal position is on the right atrium. Sometimes in the SVC to the right atrium tip they say. Sometimes SVC may get used to stay. Ideally it should be in the right atrium tip. And the exit site is below the clavicle, 4 to 5 centimeter below the clavicle, the curve. That is why you are seeing the curve in the X-ray. So these kind of spotter you might get. Most of the nephro resident knows how it is entering the vein above the clavicle and it is coming out at the 5 centimeter below the clavicle, how this tunnel is formed. See, initially we used to put a cut there where guide wire is placed, tunneling is made, the catheter is from the entry site at the internal jugular vein, we will take out the catheter. Then again we will put it. Finally we will suture it. These are the technical steps. I think there is a video in this channel regarding how to insert the permacath that you can see if you want. For the medicine resident, there is a cut, then we close it. That is why that U-turn is there. You might not see catheter above the clavicle. You will just see the exit site. Okay, this is the right side X-ray permacath description. Let me show one X-ray which is showing permacath on the left side. I think you can see the X-ray in the background. Now you can see the permacath which is coming like a snake from the left side. There is a U-shaped entry. Above the clavicle it will enter the internal jugular vein. Then it connects into the brachiocephalic trunk, goes to the SVC and goes to the right side of the heart. So this is the X-ray on the left side. This is lengthier, whereas simple catheter will be straight. You can easily make out. At least in this video, the X-ray finding on the right side, permacath, and left side. Now both are shown simultaneously. Now both the X-rays you can see simultaneously. On the right side, you can see the catheter is U-shaped and coming towards the right atrium. On the left side, you can see how the curve is above the clavicle it is going, taking a U-shaped turn, going through the internal jugular, brachiocephalic and going to the superior vena cava and to the right side of the heart. This is how it appears on the left side. This is how it appears on the right side internal jugular vein. This is the X-ray finding. Externally how it appears, patient will only have a catheter which is visible below the clavicle with the two arterial side and venous side, but catheter will be only in the vein only. You can see some kind of bulge. The catheter will produce some kind of bulge. That's all you can see. Nothing more you can see in the patient externally. X-ray, you can see it. So that's all regarding the Perma CATH. Any further queries you can comment upon. Many other X-rays I will try to upload in the short, because students told to upload whatever the X-ray we are encountering to upload. I'll try to upload it in the short. Bye bye. We will see in the next video.